Good afternoon, everyone. Again, it's good to be back with you guys. Robert Hall, Project Elect, Chairman. We're coming back on with you today. I know it's been since March the 24th since we have been on. We are a conduit for the community, enthusiastic leaders engaging in changing times. And there's a lot changing out there. I just wanted to commend Project Elect Men. We had our annual planning session this past Saturday. Got a lot of good things on the radar to get information out to people. Our members are they're just ready to go, volunteering and giving back to the community. But today, as always, we have Dr. Rayford back with us, Dr Rayford, and we have been working just hard getting the information, and there's a lot of new stuff that's going on out there that we're going to share with you guys during this session. And right now there's a hot issue, and we'll get to it, about the J&J, the Johnson & Johnson vaccine. So Dr. Rayford, nice to have you again. Proud to have you above on Project Elect again. We realize that we have worked you pretty good. So so today, and we talked back on March 24th, our last broadcast. And so we're going to ask the people that's with us tonight to please share this, because it's going to be some really candid conversation about the vaccine. We're going to ask you to visit our YouTube channel as well on this. And so can you bring us up to date since March the 24th on where we are with COVID?
Yeah, so thank you, Robert. It feels strange to both be the guest and a member of Project Elect. I'm excited about being the guest and excited about the work we've been doing with Project Elect, working in the community. So, some of the things that I want to highlight are some of the work that we're doing in the community that's been certainly well supported and kind of taken across the finish line by Project Elect. Since March 24th, from a COVID standpoint, we've seen our numbers largely go down in Mississippi. There's been a little uptick as of late. So the last 3 or 4 days there's been an uptick in the number of cases. Fortunately, the number of deaths have come down, the number of hospitalizations have come down, and the number of vaccinations have actually gone up. So there are a lot of vaccinations that are happening around the United States, over 200 million vaccines, and that's a big number, and I don't remember the exact number. 200 million, well over 1 million vaccines in the state of Mississippi. But I want to emphasize that although the number of vaccines given out are a lot, there's still significant portions of the population. So if you look at Mississippi, where maybe a quarter have gotten at least one dose, at least one dose, and maybe a quarter are fully vaccinated. And then those numbers are too low for us to get to that point where we can resume normal activities. And so there's an opportunity for us to continue to promote the vaccine, continue to promote safety from COVID, as well as promoting the vaccine. And that's what we've been doing. We've been doing it with these videos for Project Elect, but we've also been doing it with the efforts in the community. Project Elect, we've actually been doing some mobile vaccine sites, and you'll actually see a flyer at the beginning and end of this broadcast, and I encourage you to share this. We're actually going to go down to Aberdeen, Mississippi, in partnership with churches there, the NAACP there, and the city of Aberdeen. We're going to deliver vaccines from 1 to 5 at the Park and Recreation Building. We're going to give the Moderna vaccine, and we'll talk more about the vaccines a little later. But this is a coalition. It's called the Northeast Mississippi Coalition Against COVID-19. Project Elect is one of the founding members and have been supporting the mission. We all work together on a volunteer basis to increase the access to vaccine in the community, as well as work collectively to address vaccine hesitancy. What better way to address it than to be given the vaccine yourself? And we believe in it so much that we're willing to do what it takes to get it and then bring it to where you are. And we've been fortunate to have many partners. I don't want to name them because I might miss one and get in trouble. But we've had some excellent partners, and we've been able to have mobile vaccine events in Shannon and in Okolona. And so I'm excited to report that the efforts that we're doing in our own community, supported by Project Elect and the membership of Project Elect. But there's still a lot that we have to accomplish, that if I had to summarize, and I know I've talked a while, I would tell people that this is our golden opportunity to get the vaccines in people's arms. We are fortunate that we are not struggling like some countries in Europe and India, that they are struggling through surges and trying to get the vaccines in people's arms. Mm-hmm. Right now, we're having some low numbers, and it's a perfect time to get the vaccines in arms. It will be a different struggle if we're contending with surges, increased hospitalizations, increased deaths, and still trying to get people to get vaccinations. It will make it so much harder. And so, while we have this low, let's take advantage of it.
So, and you said a lot there. So, when you tell me with the efforts of course, Project Elect have been involved, but there's other organizations, and we can probably start calling names, but it just shows the love of our community. We've got nurse practitioners out there. We've got volunteer nurses. You've had help from, I think, EMTs, help from politicians, and all of these people have come together. Nobody's getting paid. Nobody's getting anything extra. It's just the love of our community.
Yeah, it's the love of that community, and these people had love of the community before, but organizations like Project Elect to kind of bring it together. And Project Elect as that conduit to bring it together, not trying to reduplicate those efforts, not trying to establish a brand new group to duplicate it, bringing it together and coordinating. And that's the value of Project Elect in terms of coordinating. We've had, physician assistants, and what we've found is that these events and those efforts have been so well supported that, what brings me the most joy, nowadays is to see people come in saying, well, we knew you were coming, so I brought my relative. I trust you to deliver the vaccine. I trust you to answer that question. And and I think that's the highlight of what we can do, and maybe why we're finding success, that people are seeing people in their communities who are coming together, who are kind of doing the heavy lifting together to get this very important thing like vaccinations done. We still have our work to do. We still have to identify the best ways to get pockets. There are now more vaccines out there in the community. There's many vaccine providers, and there's tons of unfilled vaccine appointments.
So more supply than demand.
We have a huge supply, and we have a huge supply. There may be demand, but our demand hadn't met the supply.
Well, let me ask this. Isn't that kind of scary? And I know my next question is, okay, of course we dealt with Pfizer, dealt with Moderna. Now the deal with the Johnson & Johnson.
Yeah.
What is the deal going on with that? We were already pretty hesitant in some areas. And did that help us or hurt us any?
Well, it's to be seen. I guess I'll take an optimist spin on it with the Johnson & Johnson. So first, many people may not know what happened. So a couple of weeks ago, the FDA and the CDC announced to the country that we should all pause the administration of the Johnson & Johnson vaccine.
And so folks like me that had taken the Johnson & Johnson said, whoa!
Yep, so folks who had the Johnson & Johnson, whoa. And the reason was the pause was because there was reported 6 episodes that were in women where they were found to have a rare type of blood clot, so a blood clot that's in the vein system of the brain, also had low platelets. And why this is really significant is in the scenario where you're having blood clots and low platelets, using the first line medicines for other blood clots could make those people worse. And so this pause was done so that the regulatory experts could review the information about this very rare side effects to determine if there were any more cases, and to ultimately revisit the risk-benefit kind of decision-making process that brought us the Johnson & Johnson vaccine. And so this risk-benefit decision-making process, that's what physicians like me, nurse practitioners who don't do procedures, that's what we do all the time. We're gauging the risk of what we're trying to use. So if I'm taking care of your blood pressure, Robert, and I don't know your history,
Right.
if I'm taking care of your blood pressure, I'm weighing the risk of this blood pressure medicines against what I expect that to do to help you. And so I'm making this risk-benefit analysis. And so what happened with the Johnson & Johnson pause was that the regulatory agency said, we need to learn more. Pausing is a big deal. And if we look at what happened in Europe with the AstraZeneca vaccine, with the pauses and just kind of all of the bad press of AstraZeneca, there's definitely a concern that the process there will make it harder to get people to trust the vaccines, which are very effective, which are very safe. Not perfectly safe, because we don't have anything out there that's perfectly safe.
Right.
So what happened was, in this pause, as the regulatory bodies were gathering information, reviewing the data, so there were additional cases. I think in total there were 13 cases, so 7 more cases reported.
Now, were those females, or what did that?
They were
like
majority were in women. Majority were in women less than 40.
Okay.
And in the midst of these cases, there was unfortunately one woman who died. And so you had 6 to 13 rare cases of this blood clot and low platelets. You had 1 death. And just getting more round numbers, you had about 7.2 million Johnson & Johnson vaccines. So we're looking at an event rate, so 1 to 2 per million in terms of this rare event, and death rate 1 per 7 million. So we're talking about really, really rare. It's more likely that I get struck by lightning than, it's much likely for me to get struck by lightning than to have that reaction to Johnson & Johnson
like winning
vaccine.
the lottery.
Lottery odds are, don't listen if you're playing the lottery, but the lottery odds are a lot worse than the vaccine side effects. Right. So sorry about that. But that's what the pause was about. And so what actually happened this past Friday was the regulatory body, so the Advisory Committee on Immunization Practices, they're the committee of physician scientists, clinicians, researchers, public health experts. They got back together, they looked at the reported cases, they talked to the company, and they decided that the risk of COVID was still significant. And in this time, we've also learned that the risk of having blood clots with COVID is much higher than the risk of this rare side effect with the Johnson & Johnson. So they actually decided that the benefits of continuing vaccinations with the Johnson & Johnson outweighed the risk of this rare side effect. And so they unpaused. And so now the state departments of health have released parameters. And so the Mississippi Department of Health, their parameters are, as you are talking about vaccine safety, allow people to make a choice between Johnson & Johnson and the other two. Previously, we've had get what you've been offered.
Right.
Now, in light of this very rare side effect, which is, and I want to go back to very rare. There are many things in all of our medicine cabinets right now that have a much higher risk of causing harm. So if you take aspirin for back pain, you have a higher risk of having an adverse event, either an effect on your kidney or an effect in your GI tract. And so that risk is even more common to being struck by lightning. So, common things that we don't think anything of have more risk than the Johnson & Johnson vaccine. So back to the recommendations from the State Department of Health. Allow people to make a choice. Let people know, particularly if you're a woman and you're less than 50, know about this potential risk factor. Tell people about the potential signs of this risk factor, which seems to occur within the first 3 weeks of vaccination. and we're talking severe headache, severe abdominal pain, swelling, shortness of breath, and low platelets. So you need to have it evaluated. So if you have those symptoms, and you're within 3 weeks, then getting evaluated if you have those symptoms, for sure. If you're really, really concerned and scared, it's never wrong to get evaluated. But to let people know about the risk and to let them know about the side effects and then proceed. And, the way I think about Johnson & Johnson as an option, so those people who still want Johnson & Johnson, I encourage you to find a provider who's going to give you Johnson & Johnson vaccine. You know that you can, discussing the risk, discussing what to look for. If you're a man, that risk is much, much, much smaller. So we're talking significantly lower. If you're more than 3 weeks out from the vaccine, so you got the Johnson & Johnson vaccine, your risk is, it's approaching zero.
Okay.
In terms of that side effect.
What about, what was the diverse effect? Were most of these women African American or white women, or of the breakdown of the 13 or 14 people that had issues?
Well, I don't
Johnson
know.
Johnson?
I don't know about the the additional ones to the 6.
Okay.
6 that were first reported. But of the 6 that were first reported were white.
Okay.
And I haven't had a chance to look at to drill down to the report of the additional cases. And so I'm not sure, what to make of, kind of, is it a different risk for black women or kind of women of Hispanic ethnicity? I'm not sure if there's a risk difference there. I think any woman, the risk is still low.
Okay.
It's just any woman who is less than, so 18 to 50, they have a higher risk than a man that age, or a woman who's older.
So it was tough, I guess, with a lot of our grassroots community, and I know we talk a lot about African Americans, but I know that it's widespread of people that are very hesitant from taking any of the vaccine. So what do we do now? What do guys like you do now? Because now you're up against even more pressure of convincing people that this is the best thing to do. How are you going to come back from this pause?
Well, I think I think we continue the work. Continue the work. I think people want to know. We need to talk about it, and we talk about it in a way that, at least for me, using my day-to-day work as a physician, balancing the risk versus benefit, helping contextualize what that risk is, and whether we're talking about something real common, like having a traffic accident in Mississippi, real common, versus something that's really rare, winning the lottery in Mississippi. Sorry, lottery. But really just working to contextualize it. I think that I think that when you ask what kind of things resonate with people who may be hesitant, a trusted messenger. And so, what I hope to be is a trusted messenger, which means, if the news is good, talking about it. If the news is not good, talking about it. And if I don't know, saying I don't know. Having a message that, just making sure the message goes out that we have 3 vaccines. 2 vaccines, the Moderna and the Pfizer vaccines, using the messenger RNA platform, have 0 kind of, that kind of severe side effect that was reported. That hasn't been shown to be a result of the Pfizer and the Moderna vaccine. So we have 2, vaccines that have, that we have that don't give you that, that potential risk. And so we, really, and then, informing people and allowing people to make the best decisions for themselves, that the decision for themselves to make the best decision, but really just, making it plain, reporting, the news as it is, and then just continuing trying to be the trusted messenger, getting the message out to many different places, and then asking people what they're concerned about.
Yes.
Really inquiring about what the specific concerns are. I've had I was on the panel where the panelists, talked about maybe rephrasing vaccine hesitancy as to people who are vaccine curious, and really going after that curiosity and just saying, hey, well, what concern can I address?
Gotcha.
And I think I don't think that we're as, I don't think that things are as bad, kind of because we've had two other options to Johnson & Johnson, and those options were the majority of our vaccines. So over the 200 million doses of the vaccines given, the vast majority were Pfizer and Moderna. So, Moderna, before the pause, over 7 million doses, and the remainder has been, so I said Johnson & Johnson before the pause, over 7 million doses of Johnson & Johnson, and the majority of the other doses have been Pfizer and Moderna. And so, and another thing, my optimist thing is that what happened with Johnson & Johnson is actually a demonstration that our safety system works. That we were able to pause till we can learn more, and that's a system that works. So, for those who were worried about the speed at which it came, the political pressure under which the, vaccine kind of regulators were exposed to, seeing, the regulators say, hold up, let's take some time, let's learn some more, and then decide. We are actually seeing that at work, and that happens with other things, other medicines and other vaccines too. It just doesn't happen as in real time.
So I know there's been several vaccine mobile sites set up. A lot of people been involved, and I would say now I'd be safe to say a couple of hundred people that the coalition has been directly involved in getting the vaccine that would normally get vaccines. There's been providers that's been helped to get the paperwork and the sites in order. So now, going into the next level here, there's another site coming up in Aberdeen. I know you mentioned it at the first of.
Yeah.
And there's a lot of people involved in this. Who are some of those people from the Aberdeen area? I know that has taken this from the Lee County. I know we've been over Union County, been to Hulka. Now we're down south, and there's a group of people that have taken a hold of this from, I guess, the mayor on down. Am I correct?
Yeah. So we've been working with pastors there, and you'll have a list in the flyer because I'm going to miss somebody. I'm not going to get in trouble.
And we're going to ask people to share this.
Yeah, we're going to ask people to share the video and actually share the flyer. It's going to be on the Project Elect site where I am, and these are the people that I'm going to work with, and these are the ones. And it's been a very organic way of getting something done in the community. It's really refreshing because we're getting things done kind of through our connections. We're getting things done through relationships. And what we're doing is we are delivering a really important life-saving thing, but we're also delivering information. So we know the number of people that we put a shot in their arm, but what about the number of people who had a question about the vaccine answered? And that number is, is that number should drive us to continue doing what we're doing. And with Project Elect, with the Northeast Mississippi Coalition against COVID-19, to continue to do, we have a long way to go. So less than a quarter of all Mississippians are fully vaccinated. We know that kids, so less than 16. Right now we don't have a vaccine recommendation for kids less than 16, and they make up that group. But we still have some ways to go for adults to get the vaccine, young adults in particular.
So back in the day, when we were coming up, we had what we call shade tree mechanics. Those kind of people that they worked on the car but wasn't really licensed. They kind of figure out how it worked, and they would tell you, whatever. What's scary about this is we've got a lot of people out there that don't believe in the vaccine, but they are influencing other people not to take the vaccine, and they're not backing it up with any medical data. They're not talking to the professionals, not talking to people like you about it. And I hope I'm not putting you on the spot, but isn't that dangerous?
It is dangerous. People will
It's
die.
almost like me talking about medical stuff. I don't know anything about it.
Yeah, I mean, people will die. Robert, I like you, but I wouldn't take medical advice from you.
Right, exactly, exactly, yeah.
You know, and so,
Yeah.
but you know, you shouldn't take financial planning advice from me.
That's true. That's true.
So, you know, what I will say is, I know, so there's things that we need to do on both ends. So us as the learned, trusted advisors, we need to make sure that we're approachable. We need to make sure that we are, you know, that we show empathy, that we understand. The wrong message is you're not getting the vaccine, what's wrong with you? That's the wrong message. We need to be able to say, hey, what can we do to help you learn more about this, to help influence your decision? And, you know, we need to make sure that we're talking to those folks. You know, there's a population in every group, white, black, you know, Hispanic, Democrat, Republican. There's a population that just don't want it. Those are not the people that we need to devote our energy to.
Gotcha.
There's a bigger group of people who are, I think I want it, but I think it's a good thing, but I have reasons to get it, but. And if we can help them get a little closer to say, you know, I'm ready, but we have to meet that readiness with the vaccine. So it's not enough for us to convince people through mediums like this and not have some vaccine lined up for them to get. If you wait a long time, that's enough time for that relative in fill in the blank to call and say, well, I don't want you to get that vaccine. I don't want you, you know, that relative who's, you know, feels strongly that, you know, we're able to get people, you know, get people to make that decision with the right information. It is dangerous. It's not new. You know, it's not new. Being anti-vaccine is not new. Unfortunately, that's a movement that's grown. That's not new. There are some big historical things that we have to contend to. We have a medical system that has not been fair. We have a medical system that has actually been exploitative, if that's a word. That we've exploited vulnerable groups for the medicine. You know, there's a lot of medicine that's been earned or done on the backs of vulnerable people. There's been a lot of care that's been denied. And so I know as someone in the community that being worried about that ain't wrong. And so I have to talk about that too.
Right.
You know, talk about that and help people, you know, and acknowledge them and say, you're right. We have not done right by every group all the time.
Okay.
Doesn't diminish anything we're trying to do now.
Right, exactly.
It just means, hey, that's a reality.
You gotta do something different.
Right. The very presence of me here, you know, means that this is something and this is something that, you know, is important. You trust me, and I want to make sure that, you know, that trust is rewarded by giving you the best information for you to ultimately make the decision.
The last thing, I know we're winding down, there are some new CDC guidelines out there for vaccinated people.
Yeah.
And I know that you've been working hard, even with talking with people on the state level, people nationally, and so on. So, as far as these new guidelines for people that's vaccinated, what can you kind of break that down for our audience as well?
You know, there are CDC guidelines that relax a lot of the restrictions for people with vaccines. Fully vaccinated people can, you know, engage indoors. You know, or fully vaccinated people, there's no recommendation for them to mask up when they're engaging indoors with other fully vaccinated people that they know. What I will say is the CDC guidelines have to strike a balance between practicability and protection. And so far we've known that extreme restrictions are poorly tolerated in many communities. So what I would tell people is what recommendations I would make for you depending on what your underlying health is and who you're around. If you got somebody that's at high risk of dying from COVID, then I would keep the most restrictions when I'm interacting with folks I don't know. I would keep those restrictions when I'm interacting with folks that I know aren't vaccinated. If you yourself have a risk factors for dying from COVID, even if you have the vaccine, your risk of COVID isn't zero. And I think the argument about masking and all that, the risk isn't zero. So if you don't want to be the unlucky person to get COVID after you've been vaccinated because you would do poorly, then you need to continue the restrictions, because there's no debate that masking, reducing group sizes, keeping things small indoors, doing things out, there's no debate, no substantive debate that those things haven't made a difference. That we could have very well had over 1 million people dying of COVID.
Right.
If those measures weren't in place until we can get a vaccine. The vaccines are not 100% effective, and we should not act like they are. So now, what we should do is have an individual risk assessment. Ask yourself, will the person that I love, if they have risk factors for doing bad from COVID, then I don't want to bring it at all. How much risk do you want to expose your most loved? I think about my grandma. How much risk do I want her to be exposed to? That answer is 0. At the expense of me wearing a mask outside around people I don't know. At the expense of me not doing a lot of cram things inside. At the risk of me rethinking some of the events. I think that's the way we should now think about the recommendations. CDC guidelines are excellent, but it really depends on your risk and how much risk you're willing to tolerate, for yourself and the ones you love.
Well, man, we thank you for pushing this. We thank you for your love for the community, being with your family, the things that you do to push this in the community. And so we're going to ask the people out there in the audience to please continue to share this video. We're going to ask you to check out Project Elect YouTube channel. Again, we're about to get out of the way, but I'm Robert Hall, chairman of Project Elect. We're pushing community awareness, pushing information into the community. Thank you, Dr. Rayford, and last I'll say Aberdeen.
So
This weekend.
Aberdeen Park and Rec building from 1 p.m. to 5 p.m. You'll see the flyers. Help us by spreading the word. Show up. Come say hey to us.
Okay. All right. Great. And again, the man behind the camera, Mr. Maurice Shumpert, our place here we're with. Thank Mr. Ray Shoemaker for the use of his facilities today. He's part of Project Elect. Until next time, Robert Hall. See you then. Thank you.